the digestive system. Okay. So digestive system again very important system for like a human body. So there are three large system. One is the digestive system, second is the cardiovascular, and the third is the musculoskeletal system. Rest of the organ systems are very small, but these three are a little bit big. Okay.
Can you please repeat it, sir?
So there are three very important system: digestive system, musculoskeletal system, and the cardiovascular system. Cardiovascular we already discussed yesterday, है ना? Today we will discuss digestive system and musculoskeletal system. So these are the bigger systems. Okay. So you will need to learn more and more. Okay. Other systems are very small, like eye, ear, lungs. So the organs are very limited over there. So you can complete these in short time. But for the digestive system, musculoskeletal system, and cardiovascular system, you need to give more and more time, okay, to understand the things. Okay. So the function of the digestive system is digestion, absorption, and elimination. So normally we call it ADME, ADME, ADME. So ADME means A for absorption, D for distribution, M for metabolization, and E for elimination or excretion. So first you need to eat something, then the, that whatever you eat, it need to be absorbed in your body, then distributed, okay, break down, है ना? And finally it need to be out from your body. Okay. Normally we call digestive system as gastrointestinal system. Gastrointestinal system. Because your stomach, your intestine, and other body part also involved in your digestive system. Okay. So first we start with mouth. Okay. So your lips are opening of digestive system. Okay. So I told you that every medical term have word root. Okay. So there is a word root for lips. That word root is chilo. Chilo. Chilo.
Zero.
Chilo means lips.
Lips.
Okay. So there are two lips. Labio is also lips. Okay. So either you can say labio or the chilo.
Zero.
Okay. So it's a opening of your digestive system. And what its formation is your cheek. Okay. Cheeks are formation of digestive system. Okay. So there is a again word root for cheeks that we call bucco. So these are the buccal cavities. Okay. And we call it bucco. Okay. Once you are open your mouth, first you will see the teeth.
Yes.
What you see?
Teeth.
Teeth. Again, there is a word root for teeth. That is either you can say odonto or dento. Dento.
Dento.
So whenever you have teeth problem, you go to the dentist. So dento means teeth,
Teeth.
or ist means specialist.
Yes.
So dentist is teeth specialist. Okay. And teeth are white. Then there is a pink portion also. Okay. We call gums.
Gums.
So there is word root for gums also. That is gingivo.
Zero.
Gingivo means gums. Okay. Then you open your mouth. What you see? Tongue. Okay. So tongue is lingua.
Lingo.
Yeah. Lingua means tongue. Or glosso means also tongue. So if you see the any like book, there is a glossary. Okay. So you can remember easily. So everything will be on your tongue.
Yes.
Okay. So glosso means tongue and lingo means
Tongue.
tongue. Okay. Then if you roll out your tongue, है ना, above, so there is a like a roof, है ना,
Down.
that we call palate. Okay. Roof of the mouth. Okay. So roof of the mouth is palate.
Palate.
So if you roll out your tongue, the initial part is hard, then it will become soft. Okay. So we call it hard palate and soft palate. So just roll out your tongue front to back. The initial part, yeah, upper part is hard. Then once you roll out, you feel soft.
Yes, sir.
Na? So there are two pellets, hard pellets and soft pellet. And again, pellet word root is paleto. Yeah, paleto means pellet. Then once you open your mouth and see in the mirror, you will found something which is hanging.
Yes, sir.
Okay. So the hanging portion is called uvula. You can see in this image
Yes, sir.
uvula.
Uvula.
Uvula. Apart from the uvula, we also have on the side tonsils and adenoids.
Yes, sir.
Tonsils and adenoids. So we have lips, that is chilo or labio. Then we have cheek,
Cheeks.
that is bakko.
Bakko.
Okay. Then we have teeth,
Teeth.
dento.
Dento.
Then we have gums,
Gums.
gingivo.
Zinz.
Gingivo. Then we have tongue,
Lingo.
lingo
Lingo.
or glosso.
Glosso.
Glosso. Okay. So when we are going on the road, so suppose if you are coming from your home and I just call, where are you? So what you will say? Okay, I am on the road, on my way.
Yes.
है ना? I am on my way. Okay. So there is a way. So if you are on the one side of the way and you want to cross that way, so you have three method.
Yes, sir.
Either there will be a zebra crossing, underpass, or the flyover, footover bridge, footover bridge, footover bridge. So what we call underpass normally,
Only inside.
there is a burger brand, burger, Subway.
Subway.
Okay.
Yes, sir.
So way, and if you go under, that is subway. Okay. So it's your lingual area, tongue. So if under the tongue area, below the tongue area, there is a sublingual area. What is sublingual area? So lingual and sublingual. Some tablets, physician told that you need to take sublingual, especially in the case of the heart. Okay. So lingual area and sublingual area. Okay. Then there are three glands also. Okay. So there are three glands: parotid gland, sublingual gland, and submandibular gland. Okay. So you need to remember these three glands. Okay. Parotid gland, submandibular gland, and sublingual gland. Then we have pharynx, which we call throat. Yeah. So there are three parts of pharynx. Okay. Nasopharynx, oropharynx, and laryngopharynx.
Yes.
Oropharynx,
Oropharynx.
nasopharynx, and laryngopharynx. Larynx is voice box. Okay, larynx is voice box. Then we have epiglottis. So epiglottis is the division between your respiratory system and the digestive system. From epiglottis, our system divided into two parts: the digestive system and the respiratory system. So currently, which system we are discussing? Digestive system. Okay. So till now, we have a throat, which is common in both digestive system and the respiratory system, and there is a epiglottis. Then now we move to into the digestive system. So there is a esophagus.
Yes.
So esophagus is also known as food pipe. Yeah. Esophagus is also known as food pipe. Okay. So the word root of the esophagus is esophago. Yeah. So if there is a inflammation in esophagus, then what will be the medical term for that? What is the medical term? If there is an inflammation in the esophagus, then which medical term should be there?
Digestive.
Esophagitis. Itis is the inflammation. Okay. So esophago is the word root. So what word will be esophagitis is inflammation of the esophagus. Okay. So you need to learn the esophagitis.
Esophagus.
Phagitis. Yeah. So you need to learn these all the word root and the suffix.
Yeah.
Okay. Then we have stomach. So stomach is also known as gastro. Gastro means, so if the patient has inflammation in the stomach, then what will be the medical word?
Yes.
Gastritis.
Gastrologist. Gastro. Yeah.
You are not reading at home. Gastritis. Gastro means stomach and itis is inflammation. Not specialist. Inflammation. Specialist is logist. Yeah.
Gastro.
I am just asking that what is the medical term for inflammation of the stomach? That is gastritis. Until unless you did not learn the things, then it will be very difficult because you always will be confused. Okay. The practice is very important. So there are three parts of stomach. It's a fundus, body, and pylorus. So your stomach divided into three parts. First part is fundus, then we have body, and then we have pylorus or pyloric sphincter. Okay, no, not pyloric sphincter. Pyloric sphincter is the junction. Okay, so this is the pylorus. So your stomach release the hydrochloric acid. Okay, which help to digest the food.
Yes.
Okay. Then we have small intestine connected with the stomach. Okay. So small intestine divided into three parts. So the first part is duodenum, second part is jejunum, and third part is the ileum. So you will learn two ileum. One is ileum, that is small intestine, and there will be one more ileum ilium, which known as hip bone. Yeah. So in hip we have three bone. So the spelling will be ilium. Yeah. So we have three part in small intestine. Intestine word root is entero. Yeah, entero. Okay. Then we have large intestine, which known as colon. 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 So large intestine is known as colon. है ना? So large intestine have four part. Okay. So there is a junction between the small intestine and large intestine. Okay. So that we call cecum. Cecum or ileocecal valve. So cecum or ileocecal valve is the junction between the large intestine and the small intestine. Okay. Then we have first part of large intestine, ascending colon. So it's a work like ascending, transverse, descending, and then sigmoid. Okay. So there are four part of large intestine: ascending colon, transverse colon, descending colon, and sigmoid colon. Yeah. Then we have rectum and anus. So your digestive system start with mouth and end with anus. So whatever you eat, you need to excrete via anus. Okay. Okay. So there are four parts of the large intestine. Okay. The ascending colon, transverse colon, descending colon, and sigmoid colon. So you start eating by mouth and you need to excrete by anus. So I told you that small intestine part, duodenum, jejunum, and ileum. And there is a large intestine part, cecum, ascending colon, transverse colon, descending, and sigmoid colon. Then we have accessory organs. So we have liver. So liver word root is hepato. Okay. Hepato means liver. So if there is a inflammation in the liver, then word became hepatitis. Yeah. So what liver do? Liver produce bile. Okay. Liver produce bile. And bile is stored in gallbladder. So bile is produced by liver, but it's always stored in gallbladder. Yeah. Liver also produce bilirubin. Okay. So if anybody bilirubin is very high, then he has jaundice. Normally he has jaundice. Then we have gallbladder. Okay. So the gallbladder word root is either chole, 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 or the cholecysto. Cholecysto is also gallbladder. So gallbladder stores the bile. Okay. Then we have pancreas. Yeah. So pancreas produce insulin, which help to break down the sugar level in our body. So if somebody pancreas is not working properly, he will get the diabetes. Then we have one more organ, appendix. Okay. But that is wastage organ. Okay. So in animals, it helps. Okay. But in human body, it's the use is there is no use of appendix. But if you get any inflammation in appendix or it's rupture, then it's very critical. Okay. So appendix is wastage organ. Okay. Even though if the physician remove that appendix, there is no impact in your body. Then we have disease of digestive system. First we have gallbladder disorder. Okay. So I told you that cholecysto is gallbladder. So if there is inflammation in the gallbladder, then the disease will be cholecystitis. Cholelithiasis, litho means stone. So cholelithiasis will be the stone in gallbladder. Yeah. Pancreatitis, inflammation of the pancreas. So in any organ you put the itis, it became inflammation. Gingivitis, inflammation of the gums, है ना? Uveitis, inflammation of the uvula, esophagitis, gastritis, enteritis, gastroenteritis, colitis. Okay. So anything which have the suffix itis, it become inflammation. And in any organ, there can be cancer. Okay, liver cancer, gallbladder cancer, esophageal cancer. So cancer can happen at any organ. Cancer and tumors. Okay. So it's not like that only pancreas cancer.
Yeah.
Cancer can be in gallbladder, it can be in liver, it can be in stomach, it can be in intestine, anywhere. Okay.
That thing of pancreatic cancer.
Yeah. Then we have aphasia. Okay. So if you are not able to swallow anything, aphasia means swallowing. So if you are not able to swallow, that aphasia. If you have difficulty in swallowing, then dysphagia. So this is difficulty, or A means absence. Okay, without. Then we have hiatal hernia. Okay, GERD. It's a very common disease. GERD, gastroesophageal reflux disease. If you eat something and if it reflux, yes, then it's called GERD. Then we have gastritis. We have peptic ulcer. So peptic ulcer found in stomach. Ulcer can be in esophageal also, in your mouth also. So mouth ulcer are known as the aphthous ulcer. Esophageal ulcer are esophageal ulcer. Okay. But stomach ulcer are peptic ulcer or gastric ulcer. Okay. Hematochezia is passing red blood in stool. So if a person have blood in stool, it's known as hematochezia. Okay. And if he has black tarry stool, that is melena. Okay. So it is not fresh blood, but maybe he has some bleeding. Okay. Hemorrhoids. Okay. So there are two types of hemorrhoids, internal hemorrhoid and external hemorrhoid. So as I told you that in the first step, you just need to remember all these terms. Because if you go into the deep, very deep, है ना, then you will spend too much time learning these things, and then it will be difficult to remember all the things. So first, what you need to do, the superficial study. Okay, just go to these words because you need to understand. You need to pronounce these: hematochezia, melena, hemorrhoids. Once you remember these words, then you need to go in deeper that what is hematochezia, okay, or what is hemorrhoids has been, and what impacts it can be done on the human body. Okay, so you need to go step by step because if you go any topic first time, you will only grab 30 to 40%. Okay, if you go second time, you will learn 60 to 70%. So until unless you go 3 4 times, you did not remember the words, the process. Okay. So there is a hernia also. Hernia can be happen in multiple organs. So hernia, if anything displaced, dislocated from their place, then we call hernia. The common hernia is disc hernia. Your like the spinal cord disc are slipped. Slip disc is also disc herniation. Okay, but there is inguinal hernia, hiatal hernia, gastric hernia. So there are lots of hernias are there. है ना? Then we have appendicitis, peritonitis, diverticulosis. Diverticulosis and are two very common disease. Okay. So whenever you do the coding, you will of the digestive system, diverticulosis and diverticulitis. These are the frequent disease you will found. Even though sometime in the Crohn's disease, regional enteritis, Crohn's disease, and some people have the lactase deficiency. Yeah. Then we have ulcerative colitis. So if there are ulcer in the colon, okay, then it will become ulcerative colitis. Okay. Then we have liver disorder, jaundice. If somebody have the pale skin, yes, and even the pale eyes, the person have the jaundice. Okay. Then we have hepatitis A, hepatitis B, C, E, D. Then we have cirrhosis. In cirrhosis, liver cells get dead. Okay. Hmm. So the only option will be the liver transplant, and liver transplant is very costly. So any question you have till now? So this is the flow chart. So your digestive system start with your oral cavity. Okay. So in our oral cavity, what we have? we have teeth,
teeth,
we have gums,
gums,
we have palate, hard palate, soft palate, we have uvula, we have adenoids, we have tonsils, we have three glands, salivary glands, submandible, parotid. Then we have pharynx. So there are three parts of pharynx: oropharynx, nasopharynx, and laryngopharynx. Larynx is voice box. Okay. So if I am saying something, it's produced by the larynx. The voice is coming from larynx. The pharynx word root is pharyngo. Yeah. Then we have esophagus. Esophagus is also known as food pipe.
yes, sir.
Okay. Then we have stomach. There are three parts of stomach: fundus, body, and pylorus. Then we have small intestine, duodenum, jejunum, and ileum. Okay. Then there is a connector between the small intestine and the large intestine, that is cecum.
Cecum.
Okay. So there are four parts of the large intestine: ascending colon, transverse colon, descending colon, and sigmoid colon. Okay. And then we have rectum and anus. So rectum is also known as procto. Yeah. Procto means rectum, or anus is ano. Okay. So this is the flow chart. If you remember these, then lots of digestive system is very easy to learn. Okay. Then we have common procedure. So physician can remove any body part. So the removal is ectomy. Yeah. So if he removed the gallbladder, the word became cholecystectomy. Cholecystectomy. If he removed the liver, hepatectomy. If he removed the stomach, gastrectomy. Esophagus, esophagectomy. Yeah. Tonsils, tonsillectomy. Okay. Then we have a gastrostomy tube. Okay. Some people are not able, they have the dysphagia or aphasia, they are not able to swallow. Okay. So the what physician do, they put the gastrostomy tube. So that from by that tube you can yeah, get the nutrition. Okay. Then we have colectomy. Okay. Colostomy, colonoscopy. Colonoscopy is a procedure where a physician insert the colonoscope through anus and visualize the body part. So he can see till the cecum via colonoscopy. Okay. And if we want to check from mouth, then it will be EGD.
Easy.
From mouth, they insert camera, then it will be EGD. So EGD full form is esophagogastroduodenoscopy. So the scope can reach till the duodenum. Okay. So if the physician want to check the colon, then he need to do the colonoscopy. But if he want to check the esophagus or the stomach or the duodenum or the jejunum, then he need to do the EGD. Okay. Then we have ERCP, endoscopic retrograde cholangiopancreatography. Okay. Then we have bariatric surgery, gastric bypass surgery for weight loss. So what in gastric bypass surgery physician do? He bypass the stomach. Okay. So once you eat any food, it will go to in your esophagus and directly from esophagus to your intestine. So it will not go to your stomach. Okay. Or either he do the lab band. Okay. So he put the band in your stomach, then the size of the stomach is smaller. So if somebody is very fat, they also do the liposuction or lipectomy. They remove, they cut the fat.
Yes.
Okay. So that is lipectomy. Or if they insert the needle and suck the fat, that is liposuction. Yeah. Then we have laparotomy or laparoscopy. So if there is a like he want to remove any organ in the stomach, okay, like the gallbladder. So there are two approach. Either he need to cut your abdomen, or he need to insert the scopes, and via scope he need to remove that organ. So in that laparoscopy, he need to put 3 to 4 holes in your abdomen. So one hole he will put the camera, one hole he will put the other thing. These are the common procedure diagnosis of diagnosis system. Okay. So the more you will read in when we start your coding training. Any question you have?
No, sir.